Yes. So why has the registration process changed? So as Baljinder has just mentioned, we're facing a shortage of nurses in Australia. So previously, anyone who was an internationally qualified nurse who wanted to come to Australia would potentially have to go to university here in Australia to retrain. So AHPRA has moved away from that pathway. It was very time consuming, it was very expensive, it was prohibiting nurses from hitting our workforce when we needed them. So they have tried really hard to look at what is the most effective and efficient way to get nurses into our healthcare system.
Topic, we are going to talk about discovering your AHPRA stream. This practical webinar is going to help you to identify your exact stream based on your experience and your previous qualifications. And we are very excited to be here on behalf of Nasya Academy.
Good afternoon and good evening, everyone, wherever you are watching us today. Welcome to today's webinar session entitled Understanding Your Nursing Pathway in Australia and the Right OSCE Preparation Strategies. So on behalf of Nasya Business Consultancy Services in partnership with Nurse Growth Academy, we would like to thank everyone for taking the time to join us today, for nurses watching us live, and for nurses joining us through Zoom. How are you guys? You can comment your current location. If you are currently working, you can say hi to us. How are you, nurses? And again, today's webinar is designed especially for nurses who are planning to pursue their professional journey in Australia, particularly those who want to better understand the OSCE process and the different pathways stream under the Australian nursing registration system. So many of nurses often ask, which pathway should I take? Okay, am I under stream A, stream B, or stream C? And how should I prepare for the OSCE examination? And today, we will help clarify these important questions that I mentioned earlier. This session aims to help nurses, number one, to understand the Australian nursing pathway, identify whether they belong to stream A, stream B, or stream C, and learn effective OSCE preparation and strategies, as well as gain insights from experienced OSCE educators and examiners. Wow! So our special guests for today are very special, of course. To help us understand the OSCE preparation better, we are honored to have with us an expert in nursing education. So allow me to introduce our speakers for today. Our first speaker is a registered nurse with Bachelor of Science in Nursing and with Masters of Science in Nursing, a certified critical care registered nurse, and a Sessional academic. She is also a former AHPRA OSCE examiner, an endorsed clinical supervisor, and the CEO and a co-founder of Nurse Growth Academy. With her background as a former OSCE examiner, she has valuable insights into how candidates are assessed and what nurses should focus on to succeed. Let us all welcome Miss Baljinder Saroch. How are you, ma'am?
Hello everyone. Thank you for a great introduction, Chris. I am very well, thank you. You can call me B. Baljinder is like mouthful. But I'm really excited to be here today and speaking to all the lovely nurses. I can see that Roxanne is joining us while she's on duty. So trying juggling a few things. So thank you. Very, very excited to share our insights into that can help you to bring your journey to Australia and make it smooth.
Second speaker holds a Bachelor of Health Sciences and a Master of Nursing in Education, and she is a Certified Critical Care Registered Nurse, or CCRN. She is a seasonal academic, OSCE examiner, simulation expert, and the Director of Education and co-founder of Nurse Growth Academy. With her extensive experience in clinical simulation and OSCE assessment, she has helped many international nurses prepared successfully for their examination. Let us all welcome Miss Marina Denton. Thank you so much, ma'am. How are you? Thank you for joining.
Hi everyone, thanks for having us, Chris. We're really excited to be sharing all of our knowledge about the Australian healthcare system and the OSCE and AHPRA process with everybody today. So welcome everybody, and we're looking forward to spending this time with you.
Thank you so much for the introduction, and of course we are excited and our nurses are excited to hear to talk about Nurse Growth Academy and how you can help nurses with their OSCE exam and preparation as well as the review.
Thank you. Thank you for joining us. So I'm just, for today's topic, we are going to talk about discovering your AHPRA stream. This practical webinar is going to help you to identify your exact stream based on your experience and your previous qualifications. And we are very excited to be here on behalf of Nurse Growth Academy. Right. So what we will cover today is talking about what is the demand of nurses in Australia. And then we will look at what AHPRA and NMBA are and what is their role in internationally qualified nurses coming to Australia. And then we will talk a little bit about the process before and after the streamlined pathways. And we will go into detail about how you start the process from step 1 and then coming to finding different streams. Then we will go a little bit in detail about talking about NCLEX and OSCE requirements and the exam formats. And then we will go more in detail about different OSCE stations, different mistakes that you can avoid, and locations and how you look for these exams. And when we talk about why Australia has opened these doors to internationally qualified nurses, Australia is anticipating a critical nursing shortage. According to this health report, which came out a couple of years ago, we are expecting that by 2035, Australia will face a shortage of around 70,000 plus nurses. So that's a huge gap to fill in. And this is because of the population is aging and the existing nursing workforce is burning out, and they are leaving the workforce quicker and faster than before because of the burnt out. And the burnt out is because of that increasing demand in hospitals and the aged care settings. And they are feeling the workload increasing with the number of nurses on the floor. They are either working part-time or quitting nursing as it is. So you can see that with increasing burden and shortage and nurses leaving the workforce, that's going to create a huge void, which Australia is quite nervous to fill in. So they have made everything, and nursing bodies, they have created streamlined pathways to bring internationally qualified nurses faster, quicker, and safer. And when we talk about nursing councils and bodies, you would come across a couple of terms. So let us clear it with you what those terms are and what is the role of these two bodies in nursing as a workforce. So first term is the NMBA. So you would have heard of this. NMBA stands for Nursing and Midwifery Board of Australia. So this is the main, you would have equivalent like of this would be a nursing council or something similar. And this body helps to set the standards for registered nurses or enrolled nurses or registered midwives. Okay, and they define what is a safe practice and what is an unsafe practice. So they basically set the standards by which all the nurses who are given a license to practice, they have to abide by these standards. Okay. And when it comes to AHPRA, this is again a very generally, you would have heard of AHPRA. AHPRA stands for Australian Health Practitioner Regulatory Authority. So AHPRA is a main body that manages the registration of all healthcare professionals in Australia. So it's a national body. There are no local state level nursing boards or councils. So there is one body that manages the registration of all the health professionals, nurses, doctors, physios, OTs, everybody. And when it comes to the nursing itself, AHPRA conducts the NCLEX and OSCE exams on behalf of an MBA. Okay, so that's where their role is. So all the communication, all the information that comes regarding streamlined pathways for internationally qualified nurses, that comes through AHPRA. Okay, Marina, do you want to go from here?
Yes. So why has the registration process changed? So as Baljinder has just mentioned, we're facing a shortage of nurses in Australia. So previously, anyone who was an internationally qualified nurse who wanted to come to Australia would potentially have to go to university here in Australia to retrain. So AHPRA has moved away from that pathway. It was very time consuming. It was very expensive. It was prohibiting nurses from hitting our workforce when we needed them. So they have tried really hard to look at what is the most effective and efficient way to get nurses into our healthcare system. So it proved to have inconsistent outcomes as well. So depending on your training and what university you went to, there was also different pathways over the years. So things were inconsistent in terms of the nurses that would arrive into the healthcare system. So they've looked at a way to make it streamlined, more efficient, and with that has come the outcome-based assessment pathway. So the OBA pathway, this is known also as Stream B, and this is where you have your NCLEX and your OSCE. So they're really focusing on the competence and the safety. And these assessments are at registered nurse graduate base level of Australia. You're not expected to be any super expert. It really is making sure the core base skills are covered and assessed effectively. Next slide, please, Baljinder. So what is the very first step? So some of you may be somewhere on your journey already, but if you are just beginning, that is fine. The very first step is to do a self-check. So this is free. You jump onto the AHPRA portal and you enter some basic information about which country you're from, what kind of training you've had, and it is going to allocate you a stream. So it'll be Stream A, Stream B, or Stream C, or undetermined. And we're going to talk more about those in a few minutes. But we also have a quick guide that is going to help you with that portal. So if anyone's interested in the quick guide, you've already given all your email addresses to Chris to log in for today. So we'll make sure everybody gets a copy of that quick guide as well. So next slide, please, Baljinder. So here we go. So Stream A, Stream B, or Stream C. So what does Stream A mean? So Stream A is that your university degree is deemed equivalent to the training that nurses receive in Australia. So this is from the UK, Ireland, US, certain states in Canada, not all of Canada, Singapore and Spain. You also need to prove you had a recency of practice, and that recency of practice is a minimum of 1,800 hours in the past 5 years. So depending on if you're living in the Philippines now, or you've been in one of those countries and you've done your training there, even if you're in the Philippines now, you may still be Stream A, and that's why your self-check is really important. That's going to allocate you your stream. Most of you are likely to be Stream B. So as I said, this is your OBA pathway. This is where your qualifications are deemed similar but not equivalent. So this is India, Philippines, Nepal, Sri Lanka, Vietnam, other countries similar. So what AHPRA have asked of you is that you do an NCLEX exam. So this is your knowledge and judgment exam. So that's step 1. Once you pass your NCLEX and submit those results to AHPRA, you then will be open to sit your OSCEs, which is your practical exams. And we're going to go into more depth in those in just a minute. If you are stream C, so this means that you have got gaps in your education or they're not deemed equivalent to that of a registered nurse. So we get lots of inquiries from people who are registered nurses in their home country, but in Australia that is equivalent of a diploma and not a degree or a bachelor degree. So therefore they are allocated stream C. Some of you may be allocated to an unknown stream. So what does that mean? It's not that you can't register or you can't proceed. It just means AHPRA may need a little bit more information. So this may be somebody who's done a training in one country but lived and worked in another country, and they just need a little bit more clarification to appropriately allocate you a stream. So don't panic if this is you. It just means AHPRA need a little bit more information, and they will direct you as to what they need from you to then allocate you a stream appropriately. Next slide, thank you. So with that information, who listening in the chat would like to tell us what stream they think they are? Do you think you're stream A? Do you think you're stream B? Do you think you're stream C? Drop us a comment and let us know which one you are. Or if you've worked in a few different places and you're unsure, then you may be an unknown stream. So we've got a stream B so far, one stream B. Everybody's too busy working to drop a comment. That's okay. We'll keep going as we'll keep an eye on the chat as the results come through. So if you were stream A, don't go anywhere. We've definitely got more information for you coming. So I've got another stream A, stream C. Great, thank you. And we'll keep you updated on what stream A means for you. Stream B is where we're going to do the most of our discussion for the rest of the presentation. And anyone who's stream C, this is not the end of even though what's holding in our webinar is not necessarily going to align to you, don't be disheartened. Lots of countries have bridging courses like a post-basic or something like that, which will top up your education to give you the equivalent of a bachelor's degree. Roxanne thinks she's unknown. We've got another stream B, another stream A. Excellent. So we've already outlined the first step as being your self-check, so that is a free step. But from there, you need to submit your portfolio. So AHPRA will allocate you your stream, and the portfolio submission depends on which stream you are allocated to. This is where you do need to start paying towards your AHPRA registration, and this is the first payment to AHPRA. It's 410 Australian dollars, and this will be where you put in all of your qualification information, all of your ID. If you've had a name change, say you've been married, you need to put in that certificate as well, and these all need to be certified. Another part of this stream is doing a orientation. So this is just a basic orientation to Australian healthcare. So we'll talk a little bit more about AHPRA and NMBA standards, which we very briefly mentioned at the beginning. This is where AHPRA expect you to know a little bit more about this as you progress through your pathway. So next slide.
Okay, one stream B.
Oh, next slide, please, Baljinder. Do you want to take over B, or do you want me to keep going?
Yeah, I can do. Yeah. Thanks, Marina. And so next step after the portfolio submission, what AHPRA does is then they review your documents and submission. They are very particular about about the documents and how they need to be certified, translated. So definitely recommended to take some help here, because if you try to do it yourself, it does initially seem like it's straightforward, but it can delay the whole process. If they need to come back to you multiple times asking for right documents, right information, that may delay your process. So after you've done the portfolio submission, the next step they will come back to you is about your outcome and about your next step, which is, in this case, for stream B candidates will be NCLEX RN. So it's an online theory exam. It has a validity for 10 years. If you have done NCLEX already, don't worry, it is still valid for AHPRA. And it is conducted online through multiple centers across the globe. And good news, if someone here would have had NCLEX done for US or Canada, it is still valid for AHPRA. So multiple people come to us asking the same question. So this is great that AHPRA acknowledges the same exam. It just needs some transfer of that exam results from the US board or Canada board to AHPRA, and that process is not that complex either. And in that case, then from portfolio submission, if you do have your NCLEX results, you attach it at the portfolio stage, you skip this step and you go straight to next step, which is the OSCE exam. So OSCE exam, basically after you have submitted the documents, AHPRA reviews, they must come back to you to invite you to OSCE. Okay, so it is quite an expensive exam and a high stake exam for that reason. So it makes sense to take help and get help in preparation and understanding the exam, because it is a practical hands-on clinical exam where you travel to Australia to undertake the exam. And the format of the exam is that there are 10 stations, 10 clinical skill stations, and each lasting for 10 minutes. And you would come across a simulation setting. For example, you might have a setup as a hospital or a setup as a GP clinic, where you will be assessed as a RN in practice. So there will be an examiner in the room, but examiner will be like an invisible person who is just there to assess you, would not contribute to anything that you're doing or would not correct you. There is no feedback. So you can imagine that this exam is quite stressful for anybody who's experiencing that level. We have experienced it ourselves as examiners on the other side, that candidates get really nervous. And when you're nervous, there are chances that the skills that you do every day, that you might make mistakes, and especially like under timed conditions, because you are allocated 10 minutes to complete one station. So the good news is that they do not assess you as an expert clinician. They assess you at a graduate entry level nurse. So doing the basic nursing skills. And which is good, because as an internationally qualified nurses, through your qualification, through your clinical knowledge, you have already proved that you have those skills and knowledge. All you need to is like showcase it and demonstrate it in that environment. So when it comes to how they assess you, so what is the criteria? So AHPRA assesses you under these 4 main domains. So one is safety, communication, clinical skills, and professionalism. So if you pay attention to this, clinical skill is one part of that whole assessment. So you see the safety is quite high on Australia's standards. And so are you following the safe practice? Are you undertaking the different procedures like, infection control practices or administering medications? What does safety look like in that task? Communication. So they are quite heavy on communication. How do you communicate? Is it empathetic, therapeutic communication? Are you listening to your patient? Are you acknowledging their concerns? Are you listening to their non-verbal cues? So everything is assessed. And then comes the clinical skill itself. So that that you all have. And as competent RNs in your own countries, you learn those skills. So that is one part of this whole assessment. And then they also assess you for your professionalism. So remember at the beginning, we talked about that NMBA sets up some standards of practice. So and there are code of ethics as well that the NMBA sets out. So do you abide by those code of conduct and code of ethics and professionalism? That's what is assessed here. Okay. And then, so there is no straight pass or fail. For example, if you did not know how to do the blood pressure or you didn't do the blood pressure correctly, that doesn't mean that you failed that station. So that's just one part of the whole station. If you have demonstrated safety, if you have demonstrated therapeutic communication and professionalism, you may pass that station. Okay, so that's really important to understand when you're preparing for this exam, that what is the criteria you will be assessed against. So this is the list of all the OSCE skills that you are assessed. So vital signs, a basic nursing skill, medication administration, that could be through any route, could be IV, oral, intramuscular, or subcut. And aseptic non-touch technique, that you are able to demonstrate that, whether it is through doing a wound dressing, and then IV therapy administration, then blood transfusion administration or managing a patient with blood transfusion reaction. Then is basic life support for an adult or a pediatric patient. Risk assessments. How do you assess your patient's risk of certain things, for example, falls risk or malnutrition risk or their mental status, cognitive impairment risk. So that's covered under risk assessment. And then you are assessed for, are you able to conduct focused assessment on any one particular body system? That could be from a range of like cardiac, respiratory, neurological, or gastrointestinal. So there are a number of different scenarios. You will only be able to, you're only expected to perform one. And then about communication. So there is a separate station on communication, especially considering a framework called ISBAR. So I'm not sure whether you have come across this. So Australia is very much about clear communication between patient and a clinician or between multidisciplinary teams. So that's what you are assessed here. So ISBAR, if anybody knows, I would give extra point to everyone. If you want to put in comments, if you know what ISBAR means, or have you heard of this term before? But I will reveal it as we go down. Okay, but yeah, type in the chat. And then last station is on pain management. So that is the pain management and using a non-pharmacological measurement or intervention. Okay, so these are the common skills that you will come across. And this just give you a bit of a snapshot of how those 10 minutes, what those 10 minutes look like for each station. So remember, we mentioned that for each station, you are given 10 minutes. Out of the 10 minutes, you get first 2 minutes to read the scenario, just to understand what is asked of you, what you need to perform in that scenario. So you usually will be sitting outside the room. You have no clue what the setup inside the room looks like, but you will have a piece of paper where it will be written your patient's details about their medical condition and what are the tasks that you are supposed to perform in that station. Okay. And I'll tell you that it will be written in ISBAR format. Have we got anyone who guessed what ISBAR is?
Not so far.
Okay. Well, sorry guys, this isn't meant to be a test, but you know, we are educated. We like to test everyone. So ISBAR stands for Introduction, Situation, Background, Assessment, and Recommendation. So these are the 5 components that every time you are either doing a verbal handover or verbally transferring information about your patient with another clinician, or you're writing in the documents, this is what you will be writing under those headings. And even the instructions for your station when you get from AHPRA, that will be written in ISBAR format as well. So it's a very good tool to remember, to practice. because you will see it 100 times in the exam. Okay, go back to what the station breakdown looks like. So first 2 minutes, you will read the instructions carefully. You will plan how you are going to perform, and you will anticipate, okay, I'm going to walk in. If it is a GP setting, my patient might be sitting in a chair or they might be on an examination table. If it is an inpatient setting, you might already be thinking my patient will be in a hospital bed with a trolley on the side or a bedside table, or there will be some sort of clinical setup. Okay. And the tasks that you need to perform, you will already be thinking about that. So then there is a bell that goes off, and that indicates that now you enter the scenario that you will have 8 minutes to perform. In those 8 minutes, if you first 30 seconds, you need to greet the patient and then introduce yourself, check that you have the right patient using their correct identification. And next 1 minute, you will be explaining what you're going to do. What is your purpose to come and visit them? So that's explaining the procedure, whatever you're going to do, gaining the consent from patient, whether it will always be a verbal consent in that situation, and assess your surroundings for any obvious signs that will help you to move forward. If there is like a wound trolley there, it means you are expected to perform a wound dressing. If there is like a medication, syringes and needles, it'll be related to your IV medication administration. So checking your surroundings, even when you enter the room, while you are trying to explain procedure to your patient, you will be doing that quick scan of your environment. And then you have 4.5 minutes to 5 minutes to perform the real skill. Okay, setting up whatever the skill is. If it is vital signs, you will be doing the blood pressure, their temperature and SATs and all of that stuff. Okay, and then last minute, next 1 minute, you will be wrapping up, making your patient comfortable, writing your observations in the chart, disposing of any waste and hand hygiene, and checking with your patient if they have any questions. And then one last minute again, make sure the documentation is as per the requirement and using the SBAR format if required. And then you will say goodbye to your patient or whatever and make a plan, discuss that and exit them. So that's a general breakdown for each station. So you see that the whole 8 minutes, you are not just doing the skill, you're doing lots of other things that's related to your communication, safety, and professionalism.
They do ring the bell again at the end. So if you have not finished your skill at 8 minutes, they will ring the bell and you will need to stop. But as Baljinder said earlier, that's not an automatic pass or fail. If you don't quite finish, you may have already displayed really good communication, really good professionalism. You may have done most of the clinical skills. So don't think just because you got your time cut off at the end that you have failed that station. That's absolutely not necessarily true. You need to have done the best you can in the time you have and try and get it within that 8 minutes.
Perfect. So some of the common mistakes that we have seen the candidates do, sometimes missing the correct hand hygiene. So that's a safety breach. Poor ID checks, again, safety breach. Unsafe medication practices. Failure to escalate, that's like communication breakdown there. Incorrect manual blood pressure technique, so that is related to your clinical skill. Not acknowledging patients' concerns. If you continue because you're so nervous, you want to finish the task off and you did not see your patient is still uncomfortable, they are halfway, their arm is hanging off the bed, that might be your professionalism and safety might have been breached. So little things, but you see how they are so important in the OSCE exam. So when it comes to where the exam is held, so usually the bookings happen through AHPRA. They have to, you have to receive an invitation from AHPRA to sit the OSCE, which means that you have met all other requirements. Now your last step is OSCE exam. So they will ask you to choose from different dates, pay the fee, at this stage, and then you will also at the same time will sort out your visa and make sure that you are able to come here when you are asking for your OSCE date. Okay, so choosing something which is practically possible, that's a good consideration at this point. Okay. And then in terms of where this is held, it is held, the exam is held at 2 physical locations in Australia. One is in Melbourne or Adelaide. So you don't get to choose which location you want to do the exam. It'll be based on what is planned from AHPRA based on other factors in the background where they are going to offer you that exam. Okay. So this is just a snapshot of what a typical Stream B journey looks like. So once you have done your self-check, which you can even do it today after the webinar, you do your self-check, you get to create a portal, you can get your stream straight away. Once you know your stream, then you can plan ahead. So next stage will be portfolio submission, where you submit the fee and your official communication with AHPRA starts at this step. And then once your portfolio eligibility is confirmed, you receive an email from AHPRA saying next step is NCLEX, where you then pay the fee for NCLEX exam, and also highly recommended that seek out some preparation courses, because you don't want to get disappointed. You don't want to stop your journey. It's a journey. It's not just one-time thing. Okay, you want to be well prepared. You want to save your time and money as well. So after you pass that, AHPRA receives your results straight away through their portal, and then they will offer you the next step, which is OSCE booking. You pay the fee. You are then given the exam center, and you make your travel arrangements. And then you, once you pass the OSCE results take approximately 4 to 6 weeks, sometimes 8 weeks if the busy times. And once you do that, you will receive the next step, which will be submit all your documents and you can register. And at this stage is that you are required to provide your language proficiency results. Okay, you might already be preparing that after your OSCE, or you might have already completed it, but this is the step where AHPRA needs it. Okay, and once you submit that with everything else, you will be able to register as a registered nurse in Australia. So that's, and then we will welcome you here. Okay, so just a little poll here. If based on everybody who is here today, can you tell us where you are in this journey? You might be at different stages. You might have already passed a couple of different steps. We are keen to know where exactly you are.
Yeah,
So
sorry. Miss B, actually some of these nurses are still in the process of doing their NCLEX. Some of them already passed the NCLEX, and some of them are actually still thinking, when to start. Of course, considering the OSCE examination is known to be somehow challenging based on your discussion, and also quite expensive for many international nurses, especially Filipino nurses. Considering this level of investment, the question would always be how confident nurses that after passing the NCLEX, the OSCE, all of this licensure, is there a employment opportunity in Australia? Can you somehow make a specific on that when it comes to the demand of nurses in Australia, when it comes to the opportunities, being you working there as a registered nurse?
Yeah. So we will definitely talk about that in next few slides. We already had a very warm welcome from Chris about who we are, what we've been doing, and in what capacity we are here today. So with our extensive experience as nurse educators for combined 45, that's half a century actually, And 10 years as nurse educators roles officially with the government bodies here. And we are very confident in delivering simulation-based teaching. And that's exactly what is required in terms of like preparing for such an extensive exam, which is OSCE. And myself being an ex-AHPRA OSCE examiner, that also gives us an added benefit of that what we have developed is based on our real insights from the exam. So I've seen nurses struggling with basic things, which they probably don't even notice that that's something that they're missing. It's like the way they communicate with the patient, and where the little things are missed, and the timing. They are really like, when we see that they are quite expert clinicians with great knowledge and skills because they've come that far. It's just doing it the AHPRA way, doing it the Australian way. That's a tricky bit, and that's where our first-hand experience with the Australian healthcare system is like really helping, like grooming those knowledge and skill that they have. And yeah, so that's about us. And in terms of what we offer with all the steps, we also offer, like, our main expertise is in OSCE preparation. We have developed different programs that cater for any nurses sitting in Philippines right now. If you want to start your OSCE preparation today, we can do that. So with the world moving so fast and everything being virtual, we have developed our training in a way that you can start preparing. We have got the tools. We have developed the videos and resources to help you, to push you, to prepare you for that real exam sitting virtually. And we also have opportunity, if you definitely want to have hands-on skill, that we offer hands-on practical sessions in our lab in Melbourne. And we also offer mock OSCEs as well. So if everybody is ready with everything, they just want to do that last rehearsal and practice before they step into real exam, we do that as well. And following that with registration assistance, we help you, we hold your hand with that. And the most importantly, with your immigration support. We have expert migration agents here who have helped hundreds of employed skilled workers to secure employer sponsorship. So we have had partnerships with those experts, and they found these opportunities. They reach out to these employers who are looking for nurses in a bit of urgency, and that's where they match your skills with the need, and that's where you go through employer sponsorship. But other than that, Australia has other pathways like migration, skilled migration visas, state sponsorship visas, or temporary or permanent residency. There are a number of options, but we will talk about them as we go. And we also help with CV and job readiness, because that's another critical component. You need to know what exactly the employers are looking for in your application. Because what we were trying to do after doing all the process, if you do not sell yourself on a piece of paper, they will ignore you, because there are other nurses who might be with a lot of other experience sitting there. So that's another important step. So I think we have more.
Yeah, that's not quite final message.
No, not yet. That's what we thought. Let's go back, come to this slide after that. But
yeah, come back. Yeah, one more forward.
Hey.
Okay, so nursing career pathway in Australia. So as we have been suggesting, we are very short of nurses. There are a lot of opportunities coming up. One of the most common pathways can include working in an acute hospital. We have specific mental health nursing We have a lot of residential aged care, and we also have a really large rural and remote nursing demand as well. Australia being such a large country, there are many locations that are considered rural and remote, and they do find them really challenging to get enough staff, so a really great opportunity there. And there's also community and primary care as well, so a GP clinic, for example, are really good avenues for you for your future careers in Australia. Many internationally qualified nurses do begin on a medical surgical ward to learn the Australian systems before specialising. However, it's not a one-size-fits-all. There is no perfect answer. Whatever skills you have and whatever career pathway that aligns with where you are now, there are definitely those opportunities for you when you get to Australia. Next slide, please. So this one looks a little bit busy. So this is just sort of breaking down again what I mentioned on the earlier slide. A common pathway is through a hospital setting. So our city hospitals are very large. We have medical surgical nursing. You could work in an ED department, an intensive care department. We've got lots of theatre and peri-op, cardiac specialty, respiratory specialty, or even paediatric or neonate. So depending on, again, like I said, whatever your skill set is now, you are definitely going to find an opportunity to continue in your career of choice when you get to Australia. Really high demand areas. I did say on the previous slide, these are areas that are just really crying out for nurses and are really a great gateway to get yourself into Australia is aged care. So whether it's a residential care home, dementia care, chronic disease management, they do require a lot of staff. Mental health. So we have hospitals, community mental health, drug and alcohol services, and then again, rural and remote, like I said already. So these are small hospitals and clinics in the community where they really do require you to have advanced skills and a lot of autonomy. So anyone who has got that skill set in wherever you are now, so obviously the Philippines or wherever you're coming from, are definitely a great opportunity to bring all these great skills you already have to Australia. There we go. So in Australia, we have two main healthcare sectors. So one is a public hospital and one is private hospitals. So public, as it suggests, is funded by the government. They have a really structured salary and have strong job security and clear career progression. Similarly, private hospitals are operated by private healthcare providers. So common names in Australia, Ramsay Health, Healthscope or St Vincent's. They do tend to be a little bit faster in the hiring, being non-government. They do tend to have quite diverse specialties, the same as they do in the public system, and often much smaller teams. So it's a more a smaller group of staff to be familiar with. So what do you earn if you do come to Australia? And we've just talked about all the expenses involved in your AHPRA pathway, all the fees involved from AHPRA. To sit your OSCEs, you need to fly to Australia and be in Australia to sit them. All of these things come with an expense, but don't worry, there is the reward when you do get to Australia. So the base salary for a registered nurse in Australia is around that $70,000 to $75,000 Australian as a base salary. That can increase if you consider penalties. So night shift has a penalty, afternoon shift has a penalty, weekend penalties and public holiday pay is more as well. So the average nurse, when you think about a rotational roster and your requirements to sort of share the load in terms of different shifts, you could be looking around that sort of 80 to 90,000 annually as a base salary. In Australia, for every year of experience up to a set amount of 5 years, you do get an automatic pay increase that comes with your years of experience. So between year 1 and year 5, that's probably around a 15K pay difference as you progress through your career. And then if you then go on to do additional roles, so like a clinical nurse in Queensland would be the equivalent of an in charge or a team leader, depending on where you're from as to what you'd call it. And then above that again is going to be something like a nurse unit manager, nurse educator, that kind of thing. So a lot of opportunity to increase your salary as your career progresses. Next slide. So migration pathway. So just going a little caveat here. Baljinder and I are not immigration specialists, but we do work with some. So this is what we know from our time interacting with the specialists is there's 3 main pathways. So you have the opportunity for an employer sponsorship. So that's where the hospital will sponsor you directly. An example of this might be a 482 or a 186. Next is a state-sponsored visa. So this is where the Australian state might sponsor you to come out. So this is a 190 or a 491. And then there's also the skilled independent migration that works on the point system. And this is a 189 skilled visa as well. So definitely a lot of pathways. Some of them do come with the caveat of age, though. So depending on how old you are, but under the age of 45 is where you can get one of the skilled migration visas. If you're over 45, then you may be looking for something where you are sponsored directly. But that's why we talk to the specialists. So Baljinder and I are just giving you a little bit of a guideline here, but we definitely do have the right people in place who can give you the right knowledge for your correct visa. So we might go back a couple of slides to our final steps that were a little bit out of order there, Baljinder, if you don't mind. So final message. So I have popped the link in the chat for you to do your self-check. So if you have not if you're not already on your AHPRA pathway, please do your self-check. This will tell you which stream you are and how you can get started. Skills are trainable, so you are all really skilled already. This is your base skill is already there. This is how we can support you in doing things just that little bit differently to meet the needs of the Australian healthcare system. Being prepared makes all the difference. These exams are stressful. They are full exam scenarios. You need to be prepared, and the more prepared you are, the more your nerves are going to be calmed, and the more you're going to be able to let yourself shine through rather than having your nerves take over. Let the experts guide you. So whether it's with Baljinder and I at Nurse Growth Academy or whether it's with somebody else, you need to have the right guidance. You need to have somebody in your corner giving you sound advice, who's got your back, who's making sure that you are as prepared as you can be. And advice is usually sort of cuts expenses in the long run. So if you're getting the right advice from the right people along the way and the support as you go, then when you do get to sit your NCLEX exams or your OSCE exams, passing the first time is going to be really essential. Like the OSCE exam, as we mentioned earlier, costs 4,000 Australian dollars. That is not something you want to have to sit twice. So the more prepared you are, the best chance you're setting yourself up for success. So we have a free framework. We'll share the link. I can pop the link in the chat in just a minute. And this is a free framework that Baljinder and I have developed that outlines the AHPRA journey. So whether it's Stream A, Stream B, it's a step-by-step guide that is just going to arm you with the right information to be able to progress yourself through this journey. You can also book a free chat with Baljinder and I on WhatsApp. So some of you, I know it's a texting generation, and also with the time differences, dropping us a few little messages on WhatsApp might be a little bit more convenient than a call. That's fine, whatever suits you. But we can help you chat about your stream and help confirm your stream and explore what the next options are for you. So we've got certain levels of support, and we have a big team who can help you with every step of the way. And we also have the free self-check guide, which I did mention earlier. So this is where we have stepped out everything that AHPRA are going to ask you to complete your self-check. Next slide, please, Baljinder. Okay. So for any of you who are actually ready, you've done your self-check, you know which stream you are, you're ready to just jump in, and you're ready to get going. We've got a couple of options for you today. So if you're at the portfolio submission stage, so whether you're Stream A or Stream B, we can help you submit your portfolio and make sure that you're putting in all of the right documentation as AHPRA are requiring it at the right time, as per your stream. And we also have an OSCE exam handbook. So this is a handbook that Baljinder and I have developed with our insights into the AHPRA registration exam process, as well as Australian healthcare standards. So this is something that is really well informed from Baljinder and I with our years of experience that can help you get started today.
I think that's
Oh, and then we're back to there. Lovely. Is there any question? Let me see if there's any questions in the chat.
Wow, it's really, really amazing presentation. Everything is there. You know, if nurses wanted to have an expert to guide them on their OSCE preparation, you guys are the best person to help them. And thank you so much for your knowledge and expertise and for sharing this information to our nurses today, especially for nurses joining us through Zoom and watching us live. So nurses, feel free to ask questions if you do have clarifications on questions. I think we do have some questions in the chat box right now, Miss Marina.
So Roxanne doesn't know what stream she belongs to. She has 3 months hospital experience and a long time of a private duty nurse. Roxanne, do you hold a bachelor's degree or a diploma? What level of education have you received? Sorry, I know you're working.
Yeah. Yeah, nurses, brother nurses watching us, feel free to ask questions if you do have.
Bachelor's degree, ma'am. Oh, that's fantastic. So, you are likely to be stream B with already holding a bachelor's degree. I would still suggest you do your self-check though, because we want to make sure that AHPRA agrees with us. This is just what we think as per our experience. But definitely I would recommend you do the self-check. I did pop the link to the self-check a little bit earlier in the chat, so you've got that there. And then I've just popped in the chat a link to our free framework, which outlines all the different steps for your AHPRA registration.
Well, thank you. Thank you so much for that one, Marina. And I hope we have answered your question, Miss Roxanne. So moving forward, if you need more assistance on your pathway, Nasya and Nurse Growth Academy can definitely help you all throughout the process. So we provide an end-to-end assistance when it comes to this pathway. So nothing to worry. You will be guided. You are with the right organization and with the right institution. And this collaboration help Filipino nurses to get better opportunity in Australia at the same time to pass the OSCE as much as possible one day, right? So we have this good mentors and educators who has been a OSCE examiner, and their experience is very essential for your exam preparation and review. So we do have some, for nurses who are still deciding whether to pursue their Australian pathway, Miss B and Miss Marina, what practical advice can you give them to ensure that their time, effort, and financial investment will lead to a successful career opportunity in Australia?
I can. So, guys, if you notice, like I was an internationally qualified nurse initially. So I came from India, and I came with I had a bachelor's degree, couple of years of experience. I've been here now for 18 something years. One advice I would give you, if I did not take the first step that I did then, I would still be in India and my future would have been different, right? So we all have our limitations. This is, I'm just telling you from a practical experience, you just have to take the first step, whatever that is holding you. Okay. This could be finance. This could be time. This could be just lack of knowledge, awareness. It could be anything. And you just need to take the first step yourself. You need to have that fire inside you and have that vision. And then everything is possible. And, reach out for help. Now with this today's world, globally, we are talking, sitting in Australia, talking to you guys in Philippines. We did not have this sort of information, knowledge, awareness 18 years ago. Even if it existed, I did not have access to that. So I think you guys are really in a good place to start. and just taking that step forward. That's what my advice would be.
Wow.
And it is a long journey. We're not suggesting it's not, and it can be expensive. But nothing is upfront. Everything is along the way, and you can pace yourself as per your situation allows. So if you do your portfolio submission and it's a little bit longer until you get your NCLEX completed because you work full time, you have family commitments, and it takes you a little bit longer to study, to be prepared to sit your exam, that is fine. It's really your journey. It's up to you. We're here to support you in whatever steps you need as you need them. So there's no there's no massive time constraints. It can take anything from 9 months if you are super on top of everything, you've got the money, you're ready to go, and it's just go and you're on target for everything. 9 months. But if you need to be a little bit slower, then it's 18 months, and that's fine. Starting the journey is the first step and the most important step, and then you can pace yourself as you need to suit your circumstances.
Wow. They said that the journey of 1,000 miles begins with a single step.
Yeah.
So every nurse is asking when will be the best time to start the process. I told them this is the best time to start the process. You join the event, you make an inquiry, you ask the question, it means you are interested, and that's the first step that you have. And you can do it. You have your own time, you have your own journey. The most important thing, just like Miss B told earlier, we are here to guide you and help you all throughout the process, and you have the right mentors to guide you. So we are also very happy in Nasya to have partner with Nurse Growth Academy. We've been waiting for you for too long already. I think many nurses will be guided when it comes to passing their OSCE examination. And of course, connecting them to opportunities in Australia. So do you have any other questions, nurses, before we end our session? Every month, we will have a session with Nurse Growth Academy. So nothing to worry, nurses. And if you do have questions and clarification, if you're shy to ask questions, Miss Marina shared their WhatsApp in the chat box, so you can basically communicate with them directly. And of course, as we come to an end of our session, we would like to extend our sincere appreciation to our speakers, Miss Marina Denton and Miss B, for sharing their expertise and valuable insight on the, of course, OSCE preparation and the Australian nursing pathway. That's actually a detailed information. And of course, your guidance has helped provide clarity and direction for our nurses who aspire to practice in Australia, nurses joining us through Zoom and watching us live, and maybe later nurses who will watch us in our recorded version, because we will be sending them a copy, because a lot of nurses are actually working right now. So maybe they cannot join us through Zoom, but they are really, really interested to join. And of course, for nurses watching us live as well, I've been seeing a lot of viewers in our Facebook Live. So you can always go back, and we will be sharing as well the contact information of Nurse Growthway. They have their website, they have their Facebook page, so you can go over to all of their social media platforms. And we would like also to thank everyone who joined us today. We hope this session has helped you better understand your pathway and how to begin preparing for the OSCE with confidence. So before we end, Marina and Miss B, do you have anything to say to our viewers and to nurses who are still thinking maybe this is the best time, or maybe I'm just waiting for a signal to start, and maybe this is their signal to start. Any message to them, guys?
I guess, as we said, that there's no better time than to start now, and the journey can be as you need it to be, but getting the right guidance along the way, like I said, whether it's from Baljinder and I, we are more than happy to support you, but make sure you're getting the right advice from the right people to support you on your journey. And whether I'm a little bit biased or not, I have to say Australia is a really fantastic place to live. I've been a nurse in Australia my entire career since I started in a nursing home when I was 19. So I won't age shame myself, but say that's been a very long time. And I can't imagine my career ever leaving nursing. So it really is an amazing healthcare system to work for and to work within and to be part of. So, but we also need you. So please come.
Wow.
Mm.
Thank you for
Yeah,
that, Marina.
I
How about
I
you,
can
Miss B?
say it firsthand. I have experienced Indian nursing healthcare system as well. The level of respect, the knowledge, the reward you get working here. You might be doing the same job, but yes, the pathway isn't easy, but good things don't come easy. You earn it. You must earn it through hard work and dedication. And but we are really thankful, grateful for having us here tonight, Chris, and everybody who communicated with us. We can see that if you are that interested, the dedication, Roxanne, I can see you really want to do it. I would love to see you on the other side along the way. It'd be amazing.
Wow.
Yeah.
Oh, awesome. Thank you. Thank you so much for that one.
Yeah.
Roxanne said that I think I got the right guide now. Yeah,
Right.
basically, you have the
Yeah.
right guide now. So everyone, thank you so much. And if you are interested in guidance, preparation, and support or understanding your pathway, our team from Nasya Business Consultancy Services and Nurse Growth Academy will be happy to assist you and guide you all throughout the process. Everyone, Miss Marina, Miss B, and to nurses who join us through Zoom and join us live. Thank you, everyone, for joining us, and we wish you success in your international nursing journey. And thank you so much. Have a great day and stay safe, everyone. God bless you, everyone.
Bye. Thank you. Bye.
Well, thank you. Bye.
All right. Thank you, everyone.